Endometriosis impacts 1 in 10 women. Not everyone with endometriosis will have infertility or difficulty conceiving, but when they do, it can be so frustrating and confusing. If you want to learn about endometriosis causing infertility, watch this video. I'm Dr. Lora Shahine. I'm a double board certified OBGYN and reproductive endocrinologist, helping people with endometriosis and infertility for almost 20 years. I'm currently practicing in Seattle, Washington, but I love educating people all around the world. In this video, we're going to review endometriosis and infertility, and there's 5 topics we're going to cover. Topic number 1, what is endometriosis? I know I've got other videos here educating on this topic, but I want to remind you exactly what it is. Topic number 2, we're going to talk about how common endometriosis is and how common infertility associated with endometriosis is. Topic number 3, we're going to answer the question, does endometriosis cause infertility? There's actually some controversy around that, so watch topic number 3. Topic number 4, we're going to go over the main theories as to why endometriosis could cause infertility. And topic number 5, I'm going to leave you with how I speak to my own patients about endometriosis and give you some tips for talking to your own doctor. Let's get started. Topic number 1, what is endometriosis? Endometriosis is a chronic inflammatory condition or disease in which tissue that looks very similar to that found in the uterine lining, the endometrial layer of the uterine lining, is actually found where it's not supposed to be. That same tissue is found outside the uterine cavity. It can be on the ovaries in a cyst or collection of endometriosis called endometriomas. It can be along the fallopian tubes. It can be within the pelvis. It can be throughout the abdominal cavity. And quite honestly, endometriosis tissue has been found throughout the body. Endometriosis can be asymptomatic, meaning causing no symptoms, and people can have silent endometriosis, but it typically presents with painful periods, pain with intercourse, and sometimes difficulty getting pregnant. Topic number 2, how common is endometriosis and how common is it impacting fertility? This is a difficult question to answer because it's a difficult disease to diagnose, but the estimate is that 1 in 10 women or 1 in 10 people with a uterus will have endometriosis. And if someone has endometriosis, the estimate is that 50% of people with diagnosed endometriosis will have difficulty conceiving or infertility. Why is it difficult to diagnose? Well, the strict way to diagnose endometriosis is to see endometriosis tissue within the pelvis or throughout the abdominal cavity, on the ovaries, somewhere outside of the uterine cavity. Remember, the definition of endometriosis is this tissue that typically is only seen within the uterine lining is found outside the uterine cavity. And the way to diagnose that is with a laparoscopy, or a procedure in which a camera is placed in a little hole in the belly button and you look inside. And sometimes you can get pathological biopsies to make sure that that's the tissue that you're seeing, but there's very specific look to endometriosis lesions within the pelvis, and that is the way to diagnose it. On average, it can take 7 to 8 years for someone who's having painful periods or symptoms of endometriosis to get diagnosed. So part of it is the definition of a diagnosis requiring surgery, and there's pros and cons to having surgery. And the other huge piece of a delay in diagnosis is people not listening to women, people being shamed for complaining about painful periods. And this is something that is so important, that if you are having periods that are painful, find someone that will listen to you. Of course, cramps can happen. Maybe Advil, Motrin, ibuprofen to help with cramps for the first couple of days. That is pretty typical, but if you're having so much pain that you're missing school, you're missing work, you're missing things that bring you joy because of pain, or you sort of dread your period coming every month because you know you're going to be in bed for a day or 2 or a couple of hours or whatever, that is too much pain, and keep talking to doctors until you find someone that listens to you. Topic number 3, does endometriosis cause infertility? Well, this is actually controversial. So it seems to go hand in hand, As a fertility doctor, I'm always thinking about endometriosis when I'm talking to my patients, whether they have painful periods or not. But I went to the American Society of Reproductive Medicine, ASRM, which is the Medical Society for Reproductive Endocrinologists, and anyone that works in the fertility field, so nurses, embryologists, urologists focusing on male fertility. So that overarching medical society does a wonderful job printing practice guidelines and summaries of disease and care, and they have a committee opinion on endometriosis and infertility, and I'll make sure and link it in the description below. So this is what ASRM says. Whereas a reasonable body of evidence demonstrates an association between endometriosis and infertility, a causal relationship has not been clearly established. And they cite that there's some studies that show that women who have surgically diagnosed endometriosis have no difficulty conceiving or have the same chance of conceiving on their own as people without surgically diagnosed endometriosis. And they note some other studies that show that treatment of endometriosis does not necessarily improve fertility chances for everyone that gets treated. So this committee opinion is wonderful, and it goes through a lot of the studies that I just kind of mentioned, but they're saying, like, yes, we absolutely see people with endometriosis have infertility, but not everyone with endometriosis will have difficulty conceiving. And treatment for endometriosis sometimes shows improvement in conceiving, but not always. So it's just a balanced approach, and it's saying, hey, the theories are there, we are still learning. Topic number 4, how does endometriosis cause infertility? Even if this is a slightly controversial statement, there are 5 main theories how endometriosis could affect someone's fertility. We're going to go through each one. Now, each of these theories is outlined in the ASRM committee opinion that I've linked below with lots and lots of references to studies, but I'll show at least one from each theory. So theory number 1, pelvic adhesions. So part of endometriosis and having these lesions throughout the pelvis and abdomen can be associated with adhesions and scarring. And if that distorts pelvic anatomy so that the uterus is tilted to one side, or if it changes the association of the ovary being next to the fallopian tube, that could affect the ability of the egg to get into the fallopian tube to meet the sperm to get fertilized to help you get pregnant. So adhesions and distortion of pelvic anatomy secondary to infertility is one theory how it could impact fertility. Theory number 2, tubal dysfunction. So in addition to distorting the pelvic anatomy and maybe the location of the fallopian tubes, there is some evidence that even without scarring and the fallopian tubes look normal on laparoscopy, that there is likely some tubal dysfunction associated with endometriosis. It could be a part of pH balance, immune system, hormonal balance, but the function of the egg and the sperm trying to meet in the fallopian tube could be impacted by the presence of endometriosis and endometriosis lesions throughout the pelvis. Theory number 2, hormonal dysfunction. I'm going to read this straight from the ASRM guideline, but show you at least one of the studies the ASRM mentions. It has been suggested that women with endometriosis have a higher chance of endocrine and ovulatory disorders, including luteinized unruptured follicle syndrome. So the follicle is ready, it's got a mature egg, but it never releases the egg. This is more common in people with endometriosis. Luteal phase dysfunction, so the second half of the menstrual cycle when the uterine lining should be ready to accept an embryo that's coming down from the fallopian tube, that there's dysfunction in the hormonal communication and the creation of that uterine lining that is dysfunctional in patients with endometriosis, and so that could affect fertility. Abnormal follicular growth, so the way the follicle is growing, and there have been some studies actually looking at some of the components from follicular fluid in patients with endometriosis compared to follicular fluid components in patients without endometriosis and seeing significant differences. And finally, premature or multiple luteinizing hormone surges throughout the cycle that can change estrogen levels and really confuse this coordination of ovulation, embryo implantation, and the hormone imbalance that can be there. Theory number 4, immune dysfunction. So endometriosis is an inflammatory condition and can be associated with altered immune cellular expression and, again, hormonal involvement and integration with the immune system, and that can alter multiple points along fertilization, implantation, and fertility. Theory number 5, impact of egg and embryo quality in patients with endometriosis. So there's lots of different ways that studies have shown that people with endometriosis seem to have poorer egg quality and poorer embryo quality compared to patients without diagnosed endometriosis. I'm going to include, again, the ASRM guideline here, include multiple studies here to show, it's been shown in multiple different ways, but again, this is one of the theories as to why people with endometriosis can have infertility. Let me recap these theories before we move on with the rest of the video. So endometriosis can be associated with infertility, even if it's a little bit controversial. Then the theories as to why this could happen is anatomy, so pelvic adhesions distorting the uterine anatomy and making it more difficult for the egg to get into the fallopian tube and function. Tubal function, even if it's not just an anatomic issue, that maybe the tubes aren't functioning as well and the egg and sperm can't find each other. Hormonal changes, immune system changes, and finally egg quality, embryo quality, and uterine implantation issues. So basically every single step of fertility can be impacted with endometriosis, so it makes biologic plausibility and it makes sense that endometriosis could be associated with infertility, even though we don't see it in every patient. Topic number 5, how do I talk to my patients about endometriosis? First of all, as a fertility doctor, I'm always thinking about it. I ask questions. If someone says they have painful periods, I ask more questions. So many people have been dismissed for their painful periods by doctors throughout their life. They just assume that I'm going to be another one of those doctors. But I ask, how does it impact your life? Are you missing school? Are you missing work? Are you missing things that you enjoy? Let's really talk about it. Any family history of endometriosis? We haven't been able to isolate a gene leading to endometriosis, but it's definitely something that can run in families. There's other things, fibroids and polyps are often associated with endometriosis. They kind of run together a little bit. Not always, but these are just little clues and little things that I'm thinking of. A lot of the medications that we use in fertility treatment are actually beneficial for endometriosis. And a lot of the protocols that we use, we're kind of thinking about that as we're choosing protocols. These days, I do less surgery in my practice as even like 10 years ago. So reproductive endocrinology used to be a very surgery-focused field of medicine. And as, honestly, IVF success rates have drastically improved. Access to care with IVF has drastically improved. There's less shame around IVF, and it's just so highly successful that a lot of people, I'll talk about doing a diagnostic laparoscopy to really see if there's endometriosis, or we'll talk about maybe doing IVF as a way to try to conceive as soon as possible. That's something I'm thinking about in my patients with endometriosis. If they're in pain or they want to have a baby, doing surgery can often delay when we can start to try again. Pros and cons. I think my patients with pain really benefit from surgery with an expert in endometriosis surgery that is doing excisional surgery. So not just ablation or burning endometriosis lesions, but a true expert that is excising the endometriosis lesions and truly working on the pelvis. I've seen it drastically change people's lives, and I have had some patients conceive without assistance after that. But I also want to have a plan with my patients, like, hey, if we're doing surgery, that is great, but if you're not pregnant within 3 months of that surgery, I don't want to wait too long to start doing treatment. Honestly, if you do surgery with a true expert, they say it can be curative. That's amazing, and I've definitely seen my patients benefit from surgery with an expert. But it's hard for me to get out of my training and my head like, oh, endometriosis always comes back. So my goal is to help people get pregnant just as soon as possible, because That's their goal when they're coming to see me. So I think about endometriosis. I don't do as much surgery as I used to. I choose protocols if I'm suspicious at all that somebody has endometriosis that's going to keep it quiet. And I really want my patients to get pregnant just as soon as possible. I hope you learned something from this video. Be sure and look at the description for links to a lot of the studies and definitely that ASRM committee opinion on endometriosis and infertility. Stay in touch. I'll put a link in the description here so you can sign up for my weekly newsletter to stay up to date with reproductive health. Be sure and like this video, comment with questions that you have, and subscribe to this channel so you get my weekly video. And as always, wishing you love, luck, and pineapples.